Hello everyone, I am Dr. Karthikeyan. Today we are going to see something about urine control. Some people, they don't have control over their urination. For example, this is a urinary bladder. It is filled with urine. Now this urine will be emptied only if it freely passes through this tube. What I am doing now is I am holding this tube tightly. Something is holding our tube tightly. When we relax that something which is holding this tube, then the urine will flow freely out of this tube. But for some people, this normal process doesn't happen. Similarly, for motion, for passing stools also, sometimes this problem happens. Incontinence, they are not able to control the sense urgency. They immediately want to go to toilet and empty their bowels. So how to reduce this problem? Let's see how to reduce this problem now. Welcome to our channel, Dr. Karthikeyan Home Remedies and Tips. See, I shown you the example, but we will see in reality, this is the urinary bladder, the tube coming out of the urinary bladder. Now we have uterus in females, the tube coming out of the uterus, and we have colon and sigmoid colon, rectum and anus, the tube coming out for passing stools. So all these tubes, how they are coming out of the pelvic cavity, what is holding together, what is giving the pressure over these tubes? See, the pressure over these tubes, actually it is created by these muscles. These pink color muscles, these are the pelvic floor muscles, and this hole in the center of this pelvic floor, what is passing through it? Colon is passing through this center area, and now this hollow area in front, what is passing through this area? The urethra from the urinary bladder and also the tube from the uterus. So now you can understand the pressure is created by these pelvic floor muscles which are holding together these tubes. Now what we are going to do, we are going to give a specific form of exercise called Kegel exercise to strengthen this muscle. Before that, not everybody will get urinary incontinence. What are the main reasons for this incontinence problem, urinary and fecal incontinence? Who will get these problems? First is age. As the age increases, the strength of the pelvic floor muscles decreases and naturally the incontinence problem will occur both for urination as well as for passing stools. Next is weight. When you are overweight or obese, naturally it will lead to weakening of pelvic floor muscles. Next is pregnancy and childbirth. During pregnancy and childbirth, the pelvic floor muscles will get stretched. This stretching will lead to weakness of pelvic floor muscles. Then for females, after any gynecological surgery like uterine surgery, hysterectomy, there will be weakening of pelvic floor muscles. And for males, especially after prostate surgery, there will be weakening of the pelvic floor muscles. And two last things, straining at stools due to constipation. During constipation, we will overstrain, which may lead to stretching of the pelvic muscles and its weakness, and severe cough, which in turn can put pressure on the pelvic floor muscles, leading to its weakness and incontinence. So let us now see how to do these Kegel exercises. This Kegel exercise is very simple, but what are its benefits? It has tremendous benefits. It not only improves urinary and fecal incontinence, but it also increases the male and female sexual drive. It prevents painful urination and recurrent vulvovaginal infection is prevented. There could be chronic pelvic pain, retrovertebral uterus, uterine prolapse. All these conditions will improve with Kegel exercise. Kegel exercise is very simple to do. What you have to do is, when you are going to toilet, what is happening? You are passing urine. Urine is coming out through this tube, and what you want to do, you want to stop this passage of urine midway. So you have again constricted this tube. Similarly, you just go and practice in the toilet. Just you feel when you are passing urine, if you want to stop it midway, which muscles are getting contracted. You can feel it very clearly. So those are the pelvic floor muscles. Similarly for males, when you pass gas, if you want to control passing gas, you will constrict certain muscles. So those muscles are your pelvic floor muscles. So your goal is to strengthen this pelvic floor muscle by doing the same. But of course, one warning for you is, this is just to understand. Don't try this in real life while passing urine. It should not be tried. It may lead to infection of the bladder. Don't try this while passing urine. Just you have to imagine like you are passing the urine, and then you have to imaginarily constrict so that these muscles get really constricted. So how to do it? Now I will demonstrate it to you. Now I am passing urine. So what I am going to do? I am going to strengthen my muscle. So I am stopping the passage of urine. Okay, I have constricted it now. Now in this process, remember one thing, when you are constricting, remember not to use your abdominal muscles. These muscles should not be constricted. Your buttock muscles should not be constricted. Your thigh muscles should not be constricted. None of these muscles should get into action. Only your pelvic floor muscles should get into action. So now I am constricting it, and also you have to breathe freely. In this process, you should not give extreme pressure over the pelvic muscles. You have to breathe freely also during that time, but at the same time your pelvic floor muscles should be constricted. This is the way you have to do the Kegel exercise. But for how long? 1, 2, 3. 3 seconds you are constricting it. Now you have to relax these muscles. How long? 1, 2, 3. 3 seconds you are relaxing it. Similarly, you have to do alternatively constriction and relaxation for 3 seconds. How long you have to do? 10 times you have to do. Is it enough if you do 10 times like this every day? No, not at all enough. You have to do 10 times like this in the morning, 10 times like this in the afternoon, 10 times like this in the evening. So now 30 times you are doing per day. So how long we have to do? See, this Kegel exercise is a exercise that is very effective if you do it for at least 3 to 4 months, because it will take some time to show the results. Maybe 3 to 6 months it may take, but it will definitely show the results. But one thing is, you have to consistently do it every day. Another important thing, I am showing it to you by standing, but you can do this exercise by actually sitting or lying down. The best thing is for beginners is to do this exercise while lying down. Why I did standing? Because it is easy for me to demonstrate all these things. Otherwise I would have shown you by lying down. You have to do it first by lying down, and then you can continue it even during your office hours. While sitting also you can do. So you can do it in any position. So if you do it, the pelvic floor muscles get strengthened, your urinary incontinence problem will reduce, your stool incontinence problem will reduce. If you like this video, press the like button below. Subscribe our channel Dr. Home Remedies and Tips. Kindly share this video with your friends and relatives. Meet you all in the next video. Until then, goodbye from Dr. Karthikeyan. Thank you.